I don't hear any conditions or corrections. Do I hear a motion to accept the minutes?
A motion to accept the minutes.
Second.
All in favor, say aye.
Aye.
Opposed, nay. Okay, minutes are passed. And the annual report. You want to talk about the annual report?
Well, I think the annual report is the 4 quarters that we've already discussed and you guys have all voted on to approve. And so this is just the acceptance
Formality.
of the annual that Link made oh so pretty right here.
I think the only thing to add is nursing and our department comes in and does highlights of our programs, adds those and does a few graphs or whatever for the annual report. Beyond that, it's what you have approved by voting sequentially.
Each quarter.
So all we really have to do is accept it.
Does anyone have any questions? Do I hear a motion to accept the 2025 annual report?
I'll make that motion.
Do I have a second?
Second.
All in favor, say aye.
Aye.
Opposed, nay. Okay.
Thank you for doing that.
They're accepted, yes.
The annual report. I thought it looked really good.
Good, thank you very much.
Look very
We have
professional.
a staff and we spread it all. and get it put
Well, that's the way to do it.
Yeah,
It's something we could be proud of if we took it to the state or something.
well, and we do send that out to the council and we do send that out to the commissioners. And then occasionally they say, hey, Link, come and tell us all what's going on in the annual report. So that could happen. It's good advertising. Shows what we do.
Okay. So as we start to work on the 2026 report, we need to look at the first quarter report.
Well, so there've been a lot of changes in the departments as far as the financials and staff. And I do want to say that Ashley has taken over as assistant director from Aaron Sanders. He left us since the last meeting for greener pastures. Of course, we've spent about a year getting him in tune with the Health First Indiana and those kind of things. So Ashley's catching up quickly, and that's why she's here today. We're glad to have her. As far as the vital records portion, as we move into the first quarter report. Yeah, we get the tabs.
Yeah.
First quarter report.
That's still annual. That's still.
Yeah.
So there's first quarter.
So if you have it up, what we have found is that the second page of the vital records needed to be redone. And that is deaths, suicides, and stillborn and infant deaths. That paperwork, it's the last thing to come to us, and sometimes I kind of am tapping on employee Beth's, the registrar's desk, because the state takes so long for them to send the information. It's usually about a month. So she had to change some information. Anyway, so the first quarter report for deaths, it's 224 total deaths instead of the original amount, 2 suicides and 2 infant deaths. So that change will be incorporated into the first quarter report. I want to report that. As far as the environmental health portion.
Oh, I have a quick question.
Yeah, sure.
Maybe I'm just looking at this wrong, or I hope I'm looking at the right thing. It says on the first page, 2026, but then it says first quarter report for 2025. That's supposed to say 26, I would say.
That is the one we just replaced.
Oh, okay, that's what you were meaning.
Yes,
Okay,
yes.
okay.
So it's the death.
So where do I find you're just giving us that verbal?
Okay, here's the first quarter.
Yeah, so what we will do is we will make the corrections determined today, and send that back to you.
Okay,
as
okay,
an-
I
as an
see. So
adjusted,
that's what you were
Amended,
thinking, sorry.
first quarter.
Gotcha. Thank you.
It was a busy day today. But we will make sure we make all corrections we discuss and send those back out.
Okay, okay, you'll send them. Thank you.
Okay, so community health, public information contacts, we always find that to be of use. In the January, February, and March timeframe, mostly we're doing meetings, education, those sort of things. Some of the outdoor chores we have, programs are not so active during that time of month, year. So you'll see a lot of things that are indoor restaurants, programs, presentations. 43 meetings for staff we go to, educational. That's pretty good between the 6 people that usually go. The KPI numbers for Health First Indiana, we note that 55 have received assistance for the underserved communities. What we're starting to do, and we'll continue on doing, and I have that later on, is the State Department of Health has a tracker for the, and it's not KPIs, what is it?
KPOs.
KPOs now. And we are listing those for the environmental. This year they have the environmental as well, and then we can track what each person in the office is doing that matches up with the outlines of what's needed for the Health First Indiana as far as the program.
Can you remind me what KPOs are?
Key performance outcomes.
Thank you.
Used to be indicators.
Yeah, I used to be in, got it.
All right. As far as wastewater, on-site wastewater treatment, so it's a good time of year. Everybody tries to get their subdivisions ready to go and ready for summer activities, building houses. We're pretty busy this year. 42 different permits have been issued already, and 98 visits from the inspectors have been done on sites to determine the layout, type, and design of the on-site wastewater. In our vector, of course, we're not dealing with mosquitoes, so there's nothing to report during this period of the quarter. In food, so we're doing about 80 to 90 food inspections a month of the brick and mortar facilities. That's divided amongst the 5 inspectors and occasionally myself. And then that's a month. But for the mobile foods, we've done about 60 mobile food trucks already, plus special events and the farm market. Ashley and other.
Did you say
family-
60? 60,
60.
60?
60 mobile food.
Uh-huh,
Yeah.
okay, wow.
And so Ashley and Kelsey and I are going out with the farm market this Saturday, and there's gonna be 22 places we inspect just from 9 to 11. As far as, they're not home-based vendors. They are selling potentially hazardous food, and they need to be licensed by us.
How often do those vendors have to be inspected?
The ones at the food market, they get a license for the entire market, which is May through September. But then we go out each weekend and people add on. Sometimes people decide they want to take a non-potentially hazardous food and wrap it in soft bacon. And so then we have to change their license. So that kind of thing will get us out there each time. So we're looking at them all, but we only do a full inspection at the beginning of each of those.
What are the restaurant requirements now? How often?
Minimum of 2 times a year after licensing, or as we like to say, more frequently if they need it.
Yeah. What if they have violations?
Yeah, and that will include re-inspections. Now that, so you'd have 2, and then if you have follow-up inspection, sometimes you see in the paper a place is mentioned in it, and it becomes progressively better as we go out and do more inspections of that. So it just depends on honestly how bad a place is or how much attention they need, whether or not how many inspections they get. Bites, 22 dogs, 5 cats. So the dogs are continuing to win. 2 bats have been sent to the Indiana Department of Health lab, and both of them were checked for rabies and were negative. And that's so basically we get the bat in our office, we put it on ice and double bag it, drive it up to the state, and the state lab gets right back to us about that. 13 tattoo facilities are licensed currently, and 23 tattoo artists are licensed. So that's one of our new ongoing programs, which were helped us get everyone motivated to allow us to have that program and ordinance as part of the Health First Indiana money. So that was good. So that's the environmental portion of the first quarter.
Okay, so for nursing, as always, we have vaccines. So, January, February, and March, our numbers are kind of down, but people don't really, it's for school anyway, they don't get panicky until April when it's the 6th grade field trip, and they might not be able to go. So, we still try to encourage them all year long to come get their kiddos up to date, to not have the panic, but here we are. So still doing the VFC and the 317 and private vaccines. Nothing exciting differently, I don't think, for this quarter. We did do one offsite clinic in March, and then we had 3 people come and get vaccines there. So we have tried to differentiate between the in-house and the off-site clinics just because we have to track that differently for the state. Communicable diseases, so we're still have an increase in chlamydia and gonorrhea. Syphilis, statewide, it went down in 25, but it's not looking too promising for 26. So, yeah, we've already had 18 that we've had to assist with and provide treatment. Maternal and child health. So March, we finally got some pregnancy tests to people that needed those tests to come in. We're still distributing our prenatal vitamins. We do the postpartum depression screening in our office, and then we do utilize WellConnect to refer families to care providers for either themselves or their children. So we have that partnership with them. Referring individuals to WIC for chronic disease prevention. So we've started, and I think it pretty much started March, but we are going out on the road for A1C checks and taking blood pressure stuff with us. So we've gone to some employer health fairs that they're doing for their staff. So we're getting out for those. So that's good.
What are the steps if there's an elevated A1C?
So if they already are a diabetic and they know that they are, we fax it to their provider. If they don't know that they are, we still fax it to the provider if they have one. If they don't have one, then we can call WellConnect with the patient sitting there and say, we did a screening, they have an elevated A1C or blood pressure or anything. They need a primary care provider, and I like to think that then they move up to the top of the list, but I don't know that for certain. But then they can get them connected with a provider. Let's see, so we still have our home visit medication setup program. Tara, is had a small waiting list. She's going through them. But she's got 21. She's a part-time position. So she's getting all those people in for school health. So the gals will go into the schools and help. They'll do education on whatever topic a teacher is interested in. They most likely are doing hand hygiene and hygiene of all kinds. That you need to take a shower every day or every other. You need to use deodorant. You need to brush your teeth. So, and they incorporate vaping education in that as well. We provide toothbrushes, toothpaste to them. They help the nurses with making sure their vaccine records are in CHIRP and that's all situated. So they'll look at records with them and help them put that in. For fatality review, we still provide safe sleep education. We still have gun locks available, and then the medication locking bags we're distributing. Trauma and injury prevention, this is going to be mainly with seatbelt safety. We did just have a couple staff go through the teen driving safety. What's it called? Yeah, teen impact, right? So they're gonna put on the talk for me next month, so I'll be able to tell you a little more about it. But basically, they'll be able to go into the schools. It's about distracted driving with teens, and there's like a big wheel, and you get to decide if you're driving in the daytime or the nighttime and how many passengers you have, and then it tells you your increased risk. So like if you just reach over to turn up the radio, then your risk goes up. So coming soon to health department near you. But this will be our car seat checks. So we've had a few of those. Our smoke alarm referrals with the Columbus Fire Department. So anyone that reports they do not have a working smoke alarm, I just email Mike Wilson and he gets with them and makes sure they have one in their home. So he'll go out and install them. For them, TB. So we still are providing TB testing and treatment and case management. I don't really want to talk too much about that because it's okay at the moment. Mary still has some LTBIs, but the numbers have decreased, so that's good. We do still offer NRT for anyone that says that they are a tobacco user and is interested in quitting. We do referrals to the quit line as well. And then access and linkage to care, that incorporates most of our referrals. So if someone's positive for food insecurity, we refer them to the food pantries where we send in the referral for SNAP enrollment. So then someone from the SNAP office will contact the individual and get them enrolled.
How is the referral for primary care different than the Well Connect? Because wouldn't you
So
normally
this
just
is the
refer
same, this one's just adults, and then the under maternal and child health is where they document pediatric.
Oh, okay.
It's the way the tracker for the state reporting is, and so I just kept it that way, but
I
it's the
see.
exact same.
Okay, that's what I thought.
And then lead, so kiddos 6 years and under are offered lead screenings, and then if they do see that they've already been tested when they were younger, We ask them all if they've moved since their last lead test, so then we can screen them and see if they need an extra a lead test for that. And then I already talked about that. That's our home visit setup. And then Colleen, our dental hygienist, is just tracking how many referrals we have with people calling in. Somehow we have managed to be on some website somewhere, but we don't know where, but people are calling from all over the state asking for help. And we're like, how do you get our number? We're from Bartholomew County. And so we're just trying to track that. So if anybody knows, like, sees our number somewhere that isn't really, she is not the coordinator for the state, but somehow it has gotten out that she is. We kind of laugh about it, but so that's it for nursing. Now the big apple to bite off is our financial situation. So because we've split it, Link has a nice write out, I'm sure, about it, but so his office tracks environmental, nursing tracks nursing, and so I know we're gonna send you an update after this meeting, because then we made it all look the same instead of looking like the hot mess that came out beforehand. So you can say your spiel. I know you got something right
Okay,
now.
yeah, I do. I'll try not to talk too fast here. I think we've got time. So the financials, as Amanda was saying, have been really a complicated process, tracking our data with frequent consultations with the auditor's office and the LAO system on payroll, expenditures, revenue, balances, since the auditor's office has set our department divisions apart as far as our budgeting, but then those budgets they come back together into the LAO system, and they then use the LAO system with different account numbers to separate the monies back out. So following along with that is nearly maddening. So our bookkeeper for 40 years, Mildred, has retired, but is working on contract side by side with Mark Stamper, who's now working with us, to understand this complexity. And the remainder of duties have fallen to Amanda and her staff due to the auditor's separation of our accounts. So in order to have one cohesive quarterly report, we have been using the same format for reporting this quarterly for as long as I can remember, at least from 2015 when I started working on this. But we're going to greatly reduce the duplicate graphs and listings on the reports while maintaining accuracy behind the scenes going forward. So for example, in the first 7 pages in this financial report, that no longer will be included because those things are duplicated by the more simple financial report, which then comes up as the health fund, the Health First Indiana Fund, the Health Maintenance Fund, the funds that nursing has. So we're going to be not only adding these in, but moving away from what was really a hodgepodge of different accumulating numbers, which really, if you look at it, your jaw kind of drops and it's hard to understand. I think moving to this new reporting will give us everything that we need, which is basically the carryover balances, well, not carryover, but the continued balances coming into the quarter, revenue gained, expenditures from that quarter, and then the balance. Now, that will be for each of our funds, all grants, and all accounts. And so we've moved from 10 pages down to 3 for just the environmental division. So that's a lot of what's going on. We included it in, and then Amanda kind of took the template and put her good numbers on it, and that's what we'll be adding into this report. We're not going to do away with the 7 pages because we're submitting this to you as a quarterly. We're just showing you in the future those additional pages won't be included. Those are just for the bookkeeper. So that's what's going on. As far as our actual, what the report is saying as opposed to process, we're running once again in the negatives at the end of this quarter because the tax receipts did not cover our budgets for nursing and environmental, and the county council then, in concert with the auditors, transferred sufficient funds to our general fund, our 1159 fund, to cover what was not included. This had been resolved in the last 4 years, but left us with negative balances this year. I sent out some questions on the specifics to the auditors and believe this has been resolved. Just for info, there is a IC code through the state of Indiana, and I think I've probably, like at my house, if you've heard it before, you raise a finger or two, how many times you've heard it. So Indiana Code 1620-2-17 is the method by which the local board of health is required to have a levy for the maintenance of the department put upon the tax valuations of the properties within the county. So this outlines the requirement to set a levy for maintenance of health department on assessed valuation according to the budget of that department, and leftover funds are not to revert to the general fund. So in essence, what this is saying is that you set our budget for the 1159, which is our fund, our basic fund. The council approves that budget, and then it is up to the county to go get the money. It's not whether or not it's available. They are mandated by an IC code to go get that amount of money from taxpayers in a line item on the tax bill. So that's why we don't see any problem moving forward with being in the negatives again. So that's why you might see negatives. Our negatives were 52,000. So if you get this sustained roll of not enough money to make your payroll, not enough money to make your payroll, and then you don't get the tax money to make your budget, then you're going to go into the negatives, and that's why it is. And government's one of the entities who can run in the negative for a while, but we want it to be positive. So that may or may not make sense to you, but that's what's occurred. So the council had some funds beyond what went into the rainy day fund, and those were used to support the health department and make up for that tax amount that was not requested to cover our budget. And that there was some confusion about whether or not the state was saying that we don't bring in enough revenue to support our budget, but we are not a revenue-based organization in government. We do bring in hundreds of thousands of dollars in grants and fees, but in order for us to actually cover our budget like a business, I would have to raise my permits thousands of dollars, and that's not something the commissioners would do. So I believe what the misinterpretation was this IC code, and not enough money was requested. So that's that. As far as Amanda, do you have anything further about it? Like we said.
No, but when Andrea sends out the minutes, I'll have her send my, oh, look, is that mine?
Mhm.
Oh,
Yep.
look, there it is.
Yep, that's yours.
That's our pretty one that we made to match links. So on my health fund though, I didn't know where to put, so I put that we did get half of our budget for the health fund by the auditor's department. But then the cash balance was what we brought into 25, so hopefully that's.
So both Amanda's division and mine were both running in the negatives. And this amount, substantial amount of money has been placed in our accounts as of April. So there won't be any further negatives. We'll be back on track. So that's what you'll see next time is some positive numbers, and that's what we want to see. So this will be added, Amanda's portion to the quarterly. We're under kind of a tight schedule all year, so you know, our thoughts today were either to bag the quarterly or to try and, with just a couple modifications, have you guys look at it and accept it, and we can send you the adjusted ones with acceptance of the changes, and therefore we don't have to pack it all into the July meeting when we're going to be talking about all of our budgets. So that was our thought process.
Okay. Any questions? That's a lot of information, but. Okay, if we have no questions, then I would accept movement, whatever. I'm sorry, I have bronchitis and I'm not feeling very good. To approve the 2026 first quarter report.
I move to accept to approve the quarterly report with the noted changes you've told us about.
Thank you.
Second.
All in favor, aye.
Aye.
Opposed, nay. Okay, you're approved. And you're gonna send that out to us then?
Yes. It's basically, we'll just take the existing quarterly and add the parts in, rescan it, and send it back to you. Unfortunately, it's so many megs. Our little system here at work doesn't, we have to divide it up. Anything over 10 megs just locks everything up.
Okay, so nursing division, you're going first.
I'll go first. Okay, so the job reclassification, that was all up about the email that I had sent out that I was gonna go and put on the county council's brain that we were gonna be asking for a reclassification for the billing specialist position. Well, I went and they just approved everything right then and there. And even though I said, this is for when I come for budget, just put this in your ear, because you have to go through the job personnel committee and then you have to do all these things and I know this is recorded, but they were just basically like, no, let's just take care of it now. So they took care of everything. There was a salary adjustment, but I had plenty in my fund to accommodate that. And I just walked out shocked. So, just so you know, since we stopped using the third-party biller for our vaccines and lead, from January to mid-April, hold on a second, no, from 25, May is when we took over to December. We finagled through and we were able to receive $55,901 for insurance billing. Now that was with some trials, so we got denied and then we rebilled and it was successful. And then just this year for January to March, we've already been able to receive almost 25,000. So we're super excited. We're doing it. It was totally scary at the beginning, but it's working out well. We've even had another health department reach out and they sent their person that's doing billing to spend the day with Elizabeth to go over, because they also broke up with the same company that we broke up with for similar reasons. So yeah, it's working out. So that, just want to give you an update on that. CPR, it is in works with partnering with the CRH EMS to be doing a train the trainer. So they are switching their curriculum right now, and they'll be reaching out to us when they're confident in their teaching, that they will then train the health department, and then we will be able to have some community classes for CPR. So we get calls about CPR a lot, where to find classes. And so we do know that there's a need. So that's coming hopefully sometime this year. Our back to school bash is going to be July 23rd this year at the health department from 2 to 5. So that's a Thursday. Of course, we will have vaccines. We will be doing dental screenings. There'll be prizes, but this year we've got somebody to come and do free haircuts for this kid. So it's just so exciting for them. I know when we do stand down and somebody goes and does haircuts there, you know, everybody comes in and they're all slouchy and then they get a haircut. And I tell you what, it gets my heart every time, but they run straight to the bathroom to look at themselves. And they come out and they are just standing tall and they have a smile on their face. I mean, you just don't know what a little haircut will do for somebody's health and well-being. But we're super excited about that. So we'll have some community partners too. So you put that on your radar and you can tell people about that. And then upcoming community events. So like I said, we've had some employers reach out to us that we've never partnered with before, about their employee health fairs. So DSI had one, that's the one we had in March. But this Friday, we're going to Force Construction, which I've never even heard of until they called. The Lindell Group's wanting us to come for theirs. And so the word's getting out, I guess, that we're not scary and we can come and we're helpful and friendly. And so we're doing A1C screenings at all of those events and blood pressure checks, and we'll take our smoking cessation information. So really excited about that. The Safety Festival is going to be held Saturday at the Columbus Police Department. So we'll be doing car seat checks. We'll be there talking about Project Lifesaver, medication safety, and safe sleep. And then we've had organizations reach out about our hand hygiene class. So the girls really just did it in the schools, but somehow somebody heard about it. And so they've already been to REACH. They've been to DSI, they've been to Traditions, and it's just fun how to really wash your hands. Like we've got the glow germ, so you put a little bit on your hands and you look under the light and you see all the germs, and then it's the contest on how clean they can get their hands. So they always pick 2 people and they send them to the bathroom and then they come back out and then they all vote before they look under the light, who thinks Johnny did the best job or who thinks Sally did, and then they look and then they're all mortified because they didn't do a very good job. But so that's been publicized somehow out in the community. So we're doing that. May 22nd, Thrive Alliance is having a health expo, so we'll be there providing services. Our newborn safety class has been successfully on the road. So today they went to Job Corps. We've been to Turning Point, and then later this month we'll be at the Excel Center. So that's getting some traction. So we're excited about that. One other thing that's not on there is had a staff that just recently completed the training to be a lactation consultant. And so we are figuring out how we're going to utilize her in the health department. But we've sent out letters. Her passion is to help the school system with the students that have had babies or having babies and how they can continue that support. So we've reached out to the schools. Hopefully next year we can get that rolling, and then we're still deciding how to utilize it in the health department as patients come in. Yeah, that's it.
Any questions? Okay. I guess that means you're up, Lee.
Okay, just basically some updates or slash others. So coming up June 1st, a lot of our budgets are due. That's why we have the July meeting with you guys before the budget review process starts. Unfortunately, the timing is that we send it all in and then they tell us somewhat after the fact what percentage of a raise they anticipate and those kind of things, if at all. But we need to get your approval before we get to the whatever August review. Interesting though that the IDOH budgets and spending reports are due to June 1st. So on Health First Indiana, they have a long, complicated thing about how you spent your money, and I'm struggling a bit with that because of the 60-40 split and the partial monies we have that are split amongst regulatory and preventive, like Ashley's salary is partially preventive and partially regulatory. So when you take the amount, you have to make sure that you divide those up and that the totals remain 60-40 after the entire process. So the county and also the county budgets and the state budgets don't use the same format, categories, or processes. So welcome to government, right? So July 1st, we anticipate a new on-site sewage rule from the state to replace the rules abolished by the 23 state legislature. So that should give us a little more teeth to get back into it. The state legislature has taken it upon itself in several cases recently to what I would most likely represent as degrade the regulatory abilities of individual counties and health departments, which is very frustrating for us. They're opening up a lot of things to consumption that don't necessarily regulate people in a safe and sanitary way would be my assessment of what's occurred. Such as the food 2027 codes determined by state legislature this year for food prep and sales include a $450 mobile food truck state license, which our mobile food truck is $150 now. But the thing about it is that if somebody gets licensed in another county, then we have to accept their mobile food truck regardless of the conditions. So an easier county, let's say, for someone to get licensed in may be the one that the majority of the food trucks go to, and then we're left with whatever they may have approved in that county, which might not have adequate staff or, all the things that Health First Indiana is supposed to help. There also is discussion because as a byproduct of the food truck regulations, it could be interpreted that they're banning all temporary food events, including farm markets, fairs, and all events where you have a temporary tent, like the farm market where you're selling things out on a table or at the 4-H fair or those kind of things. I think that the Indiana Department of Health is working hard to try and pull that out of the regulation so that we can still have temporary events. But there's an updated food home-based vendor rule, which include homestead food sales. And if you look at that, that could be that if somebody has a farm and then put a restaurant in their barn, it would be exempt from the same requirements that somebody down the road has a retail restaurant. And so those are the kind of rules that we don't really find helpful to make that much of differentiation between two things that should be the same, basically. So we have renewed interest in our data management software, which is you, this, how many times I've told you about it, right? We thought that that might be being canceled on the part of the county, but the county, I guess, has a renewed interest in bringing that to fruition. One of the things is it involves integrating our Inspectigo, which is what was supposed to be the be-all, end-all of data management. Win Records, which is our basically legacy software, and DocuWare, and then the state databases all into one cohesive software that I can generate reports from. So a lot of these reports we're doing, we don't have to do surfing and have manual entry of everybody and hand it to me every month, and then she might put all the numbers together. You could just generate a report. So we're hoping that we can work hand in hand with the county to get that completed. As far as the Health First Indiana tracker, so we have an example of that. I don't know if you have that up on one of your tabs, Ashley. But you can see that of those things that the state is tracking as far as what we do in environmental, public health emergency preparedness, and vital records, we have numbers of the people that we've served, what those health activities are, trainings, complaints, investigations. So that'll be a good way for us to then have that as a report for you as the Board of Health, as well as then keep track of the needs, reporting requirements of the Health First Indiana in order to continue forth with the budget requirements of that fund from the state funds. And we hope that these regulations are an omen in a way of the Health First Indiana was to promote public health. And then you get the regulations, which seem to be kind of freeing up the things which would be what we consider promoting safe and sanitary operations. You know, we just hope that it's not counterintuitive that they're not working together. So that's yet to be seen. I know that we have been granted the same amount of money for 2027 through the Health First Indiana. So that's great for us, and we can expand. Hopefully then over the course of the last 3 years, we can have developed these programs, found a way to work with our partners, and then to do the expenditures which are meeting the goals of increasing public health for our county and society, as well as my biggest thing is my employees. I mean, that is my, that's my shovel, that's my tools, that's my whatever, are these wonderful people who are well educated and trained, and a lot of what you do, you can't just walk in off the street. I mean, one of our trainings specifically is 2 years for on-site wastewater, because you really don't know what you're doing. You can't make interpretation of the rules within shorter period than that. So we really do appreciate the continued salary provided by the Health First Indiana for us, and we hope that continues. So that's really the big things I wanted to mention.
Any questions for Link? All right. Do you guys have any other old business? Anybody? Any new business that we haven't discussed? Well, this is fast.
Isn't that usually the restaurants?
Yes.
Announcements, yeah.
Yeah, okay, well, I guess we consider that. So outstanding plan reviews for new construction. And I will be completely honest with you. I sign these letters, send them out, but sometimes they come so frequently, I don't know where these places are located. We've got a lot of turnover. I'll just read off here the plan reviews we've done, which are open, which means that people maybe are in construction. It's on pause. Maybe they're almost ready to open. Maybe we've done partial inspections. Columbus Food Mart, I don't know if they're ever gonna be open there at 11th and
Oh, gosh.
I mean, they're so close, it's just plug things in and go. Friendly Pantry. Do you know, you can just jump in if you know any of these.
They have walls.
Okay, they have both. Okay, Nutra-B Nexus Park. Lucas Brothers, they're moving, right?
To the old Shorty's building, I believe.
To what?
The old Shorty's building.
Oh,
They
boy.
also have some walls.
I don't think they do. Misora, pre-opening inspections begin this week. Nothing Bunt Cakes.
Oh, where's
Are we-
that?
Supposed to be going in between Panera and Noodles, somewhere in that side.
Maybe
It's
where-
one of the buildings.
Is it where the chopsticks shut down?
I don't think it was, it's one of the empty ones next to Chopsticks. It's not that one, but it's like,
Noodle, something, is it?
Next to
well, Banana Salon or Verizon, yeah.
That just made
It's
my
one of
day.
those.
Comcast.
Bundt cakes.
Champion Zone Golf, I think we've done pre-opening there up at Manufacturers Marketplace and Burton Market. A DJOJ Mini Market.
I have no idea.
Okay.
Sorry.
There's a lot of hole in the wall places that are, the Forge on 4th, of course, moving from just having events to more of a dinner place. The Annex, which is the one down there on State Road 58 with the church side by side, that is going to be an event center. I know we're just starting to lay out an enormous on-site wastewater system for them. Hundreds of thousands of dollars to get rid of their liquid waste. Best One Donut. Tiptonia Commons Assisted Living. The Barrel Lounge. See, okay. The Court and Brew. Stir and Sip. Rang Chin Market. Now, where was that one?
Was that the old Denny's building or is that a different one?
Oh, yes, that is the old, I don't think that's gonna go anywhere. Yeah, out there in the floodplain. 67 Swirl and Pearl.
Ice cream over by, where they say on State Street, I think.
Okay. Olive Garden has opened. St. Denis has opened. El Guacalito. Jill's Diner moved. The Dollar General Garden City, which we had lots of issues with their water supply there being checked and since they're on a well. Gianni's King Heroes. The Cat Cafe, which I thought was a unique one. And Grin and Cluck at 16th and Central just opened. You know what they serve?
Fried chicken
Fried chicken. Grin and Cluck.
and potato chips or potato things. I actually talked to him today.
Still clucking.
Hopefully they're cooked. And AMC Theater's closed. So that's where we're at on that. So lots of little places going on. Not so big, but I know that it's kind of a letdown now that all people have been asking me. Yeah, people have been asking me about that. Nearly a decade. They finally got up. I don't know how their food service is, but
They're really clean. Did their inspection.
so we got 5 minutes. No, you had to leave at 5:15. No, 6:50. Oh, okay, we're gonna make it then. That's your tax money coming in that little area there that we spend. If I may, I had a highlight on the Health First Indiana funds. I mean, I really do enjoy that we get to use this, so it might as well be something. I'm gonna send this to Michelle Matern. Basically that to show we are using their funds in a way they appreciate. We're able to provide additional supplies and services for mosquito control program. We purchased an electric truck mounted fogger along with 15 gallons of synthetic pyrethrin treatment. We provided 5 additional automatic external defibrillators to public parks and facilities, including recreational sites and the county courthouse. We paid for removal and proper disposal of 360 tires from a site to prevent the tires holding water continuing to breathe. We provided 40 heavy plastic beware of tick activity signs to city and county parks, veterinary office, hiking trails throughout the county in response to Lyme disease and other tick-borne illnesses. Purchased 3 self-leveling laser levels to accurately inspect wastewater. Reviewed plans for inspected and licensed 13 tattoo and piercing facilities. That was Ashley's chore. Obtained a new pool chemistry kit and reagents. Paid for a temporary salary for the positions of public health preparedness and part-time environmental technicians, always provided prior by the county health funds. Paid annual fees of $43,000 for Inspect2Go data management software development on behalf of the county. Salary for second year of assistant director position as a sorely needed addition of an additional inspector and administrator. Distribution of hundreds of individual packaged insect repellent and hand sanitizing packs to those in need through local assistance programs, including not only the homeless, unhoused shelters, but at the fair, etc. And got many additional supplies, trainings, and services. So the Health First Indiana is, we're nursing environmental are using it. We need to go. That's all I have.
Anything else for the good of the order? I think we're adjourned.
Everybody write that down.
5:26, so we did it in a little less than.